Good afternoon. My name is Nate Aiken, and Brashit Tarmani's here as well. We're the two athletic trainers at Chaffey College. We were contacted by Dr. Benjamin Kamel earlier in the quarantine because he was interested in doing some community outreach. So he works at Gary Orthopedic Specialists just down the street from us in Rancho, and he wanted to do some educational sessions for some student athletes that are in the area, and we fit the bill for that. So we are going to do a little Q&A with him, just kind of ask him some questions about different things from foot and ankle care. And hopefully you guys will find this very helpful for you in your athletic pursuits. So Dr. Kamal, go ahead and introduce yourself. Give us a little bit of personal and professional history, as well as where you're working, what you're doing, and all of that.
Great. Awesome. Thanks, guys, for having me. Always happy to educate and reach out to the community and help in any way that I can. I mean, I was an athlete myself, so I always feel for my athletic community. um, so born and raised in Southern California, just over the Kellogg Hill in West Covina, so pretty close by. Been playing sports my whole life. Played football, basketball, baseball, soccer, track. But when I had to make a decision in high school between soccer and basketball, I chose basketball, and that upset my dad very much. But um, it was where my talents lied, and I went on to undergrad and played a year of basketball, and I realized I'm probably not going to be going to the NBA, so I should focus on my studies. And that's when I decided to make the switch and go to medical school. And I went to medical school at Western University here in Pomona, California, um, and went on to specialize in the foot and ankle. So I have a passion for sports, as I grew up playing it, and obviously in my career, I like to deal with sports injuries. So that's kind of how all of this has come together for me. Yeah. Gary Orthopedics. We have a couple offices, one in Pomona and one in Rancho, and I serve probably equally in either office, and I'm available at both locations, as well as the local hospitals like San Antonio Regional Hospital, as well as Casa Colina. Yeah.
That's awesome. Awesome. All right. So we're going to go ahead and get started with the first question. Thanks for the introduction, Doc. So the first question we're going to address is, what are some major factors, for example, flexibility, prior injury history, genetic and postural, maybe some fitness levels, that would predispose student athletes to foot and ankle injuries?
Yeah, sure. So how I'm going to go about this is kind of address some of the more common injuries. Some of the more major ones, of course, there's so many different injuries that can happen in the foot and in the ankle. There's so many little bones in the foot that can be injured, but I'll kind of separate it by some of the more common pathologies that we see, and we'll start with ankle sprains. So you got to think about it in sort of the intrinsic and extrinsic factors. So intrinsic factors that are things that affect you as a person or as an athlete, or that are set by you as a person. And for lateral ankle sprains, if you've had a previous injury before, that can certainly put you at risk of having another one. And the reason, if you've sprained your ankle, you've disrupted the ligaments that support your ankle, and it never really truly goes back to normal. You may feel better, you may be able to compete, you may be able to play without pain. However, there's always just that small disruption of the ligaments that always puts you at risk of developing another injury to that ankle complex. And for some reason, statistically, being a female puts you at more of a risk. We see this more actually in knee injuries. It's actually very common for females to experience knee injuries more than males. And the discrepancy is less when it comes to ankle sprains. However, females tend to, and it's just the fun fact, honestly, I couldn't explain to you why. Being taller or heavier can predispose you and put you at risk of developing an ankle sprain. Being tall doesn't necessarily put you at risk, but being taller means you're probably a little bit heavier. And if you are heavier, then you're going to apply more torque and more force around your ankle, which can ultimately lead to your ankle not being able to support that and being disrupted. Your foot type plays a huge role in whether or not you may develop an ankle sprain. So there are 3 different foot types that we kind of generalize people in, and it's flat foot, or also known as a pes planus foot type, rectus foot type, more of a normal arch, and then a high arched foot type, which we call pes cavus. Generally speaking, if you have flat feet or if you have high arched foot, those 2 can predispose you or put you at risk of developing an ankle sprain. But more so, are athletes or patients that have a high arch foot. And the reason is their heel sits in a certain position, which sort of lateralizes or puts more weight on the outside of your foot, which can make it easier for you to kind of roll your ankle. I'll see that as a risk factor for developing an ankle sprain. Something called postural sway. So if you've ever, been asked to stand on one foot and hold your balance and control your center of gravity, those patients or athletes who can do a really good job of holding themselves and holding their center of gravity while on one foot, it means that you're more supported around the ankle. And if you have a hard time with that, then you have a lack of that postural sway, which would then lead to more injuries. And from a genetic perspective, there are things that can predispose you to an ankle sprain, and it's more of a generalized laxity. So essentially, if your normal ligaments can be around the ankle tend to be taut, meaning they're kind of tight and thick, like a rope. But if you have a disorder where you have generalized ligamental laxity, then your ligaments are more like a rubber band, which a rope would support more than a rubber band, which then can lead to ankle sprains. And then some extrinsic factors, so things that aren't coming from you as a person, ankle brace, taping or lack thereof can put you at risk of developing an ankle sprain, as well as your shoes. So the type of shoes that you wear makes a huge difference. I know that each sport has their sort of specific type of shoe gear that they wear or that they must wear, or is advantageous for them to perform at a high level. But generally speaking, the more supportive the shoe is, and the better you are at supporting your structure, your entire structure. The next injury I'll talk about is plantar fasciitis. So just like with ankle sprains, your foot type makes a huge difference on your ability to withstand the strains on your heel. So the plantar fascia is a thick band of tissue that runs on the underside of your foot from the heel all the way towards the toes. So with any strain of that band of tissue or the fascia can lead to micro tears, which leads to inflammation, and it gives you that sort of nagging heel pain every time you take a step. There's plantar fasciitis, which is the most common, and there's also plantar fascial tears, which we'll probably talk about a little bit more later. But any of those injuries can if you have a flat foot type or a high arch foot type, that can put you at risk of developing plantar fasciitis. If you have weak muscles in the bottom part of your foot, we call them the flexor muscles. If they're weak, then it puts more pressure on your fascia to hold up your arch, and therefore can develop a strain or some micro tears in it. Also, a tight Achilles tendon. If your Achilles tendon is tight, it makes it difficult for you to flex your foot upwards or to bring your toes towards your nose. And this can also lead to more strain on that plantar fascia, as well as your training program. So if you go from 0 to 100, or if you do a lot of high impact activities, this can put you at risk of developing plantar fasciitis. Excuse me. Medial tibial stress syndrome, which most people know as the shin splints. Again, unfortunately, being female puts you more at risk of developing medial tibial stress syndrome. If you've had a previous history of shin splints, I see this in runners who are inexperienced, who kind of want to just take up running all of a sudden, or the athlete who wants to start getting into running or track will develop shin splints. Having a higher BMI can put you at risk, and again, too much too fast can also bring this on. And then lastly, Achilles tendonitis. This is the one where males are actually more at risk and can be more of a risk factor than for females. And then again, your foot type. Foot type is a huge proponent for all of these pathologies. And being flat-footed means that your arch will collapse and your heel kind of kicks out a little bit, and that's where your Achilles tendon attaches. So wherever your heel goes, your Achilles tendon will go, and that can put strain on the Achilles tendon. And if you don't warm up correctly, again, too much too fast on the tendon, especially in colder weathers, which we don't usually experience in Southern California, can put you at risk of developing Achilles tendonitis.
Cool. Thank you for that, by the way. That was very informative. It sounds like, from what you're saying, knowledge is power, right? And so knowing some of those risk factors that you as an individual might have, what can student athletes be doing to reduce their risk of foot and ankle injuries, specifically with those injuries that you mentioned?
Yeah. So we'll start with the ankle sprain, with the risk factors. And one thing that is huge and for any athlete, I believe, is ankle bracing or taping. There's a reason why it's been around since the 1800s, and it's because it works. There's different types. There's a soft, semi-rigid, or rigid ankle brace. And really what this does is it provides support for your ankle in three different ways. And one is a mechanical, it's an actual mechanical physical structure that can prevent your ankle from going through an excessive motions, which can cause strain on the ligaments. It also helps with neuromuscular control, basically that postural sway that we were talking about, and that feedback between your body and your mind, and your brain, can also be beneficial or can improve with the use of an ankle brace. And this can help with balance. And then the third component is psychologically. I mean, if you have an ankle brace on, this can give you confidence as an athlete to feel like I have something that's supporting me. I know that if I, do this cut on the field, I will be supported, and it could improve your, psychologically help you to improve your sports performance because you have that support. The other thing is, between bracing and taping, I really personally don't have a preference. I think that they both can provide support. Some things, with taping is there's different techniques. There are different types of braces, but they usually are kind of just, they do what they do, and that's what it is. Taping can be expensive because you got to tape every time you get on the field, every time you get on the court, whatever it is, you got to tape. And it can also take time, whether it's, you personally taping yourself or from your trainers. It's time consuming. But taping is less bulky. So there's something to consider. But if you wear an ankle brace, it's, a one-time deal. You buy it once, you wear it, you know what you're going to get. But it can be bulky at times, and some people just don't like the feel of a brace. So those are just some things to consider, as well as just doing general rehab. If you can rehab and help yourself improve your balance around your ankle with that sort of the postural sway that we were talking about, you can help strengthen the muscles around your ankle, which will help take some of the strain and off of your ligaments that support your ankle. And then for plantar fasciitis, normally I tell my patients avoid running or high impact activity, but that's basically impossible for athletes for me to tell them. So instead, I encourage all athletes to stretch your Achilles tendon and your plantar fascia daily. And I mean, even if you don't have these symptoms, I think that generally stretching of your Achilles tendon and your plantar fascia can help go a long way to prevent a lot of the most common injuries in the foot and ankle. If you're at the gas station, you're waiting for your gas to get pumped, just put your foot up against that curb and, stretch your calf. Whatever it is that you got to do, the more you can stretch it, the better it'll be for you. I talked about foot types and how different foot types can contribute to plantar fasciitis or some of the other injuries. So I also will encourage athletes to consider a custom foot orthotic, basically an insert that goes into your shoe. It's made and conformed to your foot, specifically right around the arches where we're looking, and your heel. And what this will do is we can use the orthotic to control how your foot is positioned in your shoe, and therefore to decrease sort of the excessive forces that go, or the abnormal forces that go through your foot, to reduce injury and decrease strain. And then for medial tibial stress syndrome, really there's not one proven method to treat shin splints, but wearing shock absorbing insoles, custom foot orthotics like I had mentioned, or implementing a graduated running program, and stretching, those are all things that you can do to help to prevent that injury. And then with Achilles tendonitis, again, it's increasing your activity gradually, whether it's if you're coming off of quarantine and going right into the season. It's important that you gradually get yourself there. Or if you've been sitting in class all day and you're about to go out in the field, making sure that you do your stretches and your proper warm-ups in order to ensure that you don't cause strain on that Achilles tendon. What's also important is wearing a good pair of shoe, like I spoke about before, but making sure that you are keeping up with the wear and tear of that shoe, because athletes go through a lot of miles, whether you're a runner or whatever sport that you're in, and your shoes can break down very quickly, and you got to replace them with a good pair as often as they need to be, because that's what's ultimately going to hold your foot and hold your ankle and hold the rest of your body. So yeah.
Awesome. Thank you, Doc. That was, again, really informative. So going back to the injuries we just talked about, the lateral ankle sprains, the shin splints, the plantar fasciitis. So what is some criteria that help you make that decision to immobilize those injuries?
Sure. So with lateral ankle sprains, there are 3 grades of sprain. There's a grade 1, 2, and 3, and basically a grade 1 is just a minor strain. Grade 2 and 3 are partial and full, a full tear of your ligaments of your ankle. So personally, for me, I think that, well, just generally speaking, going from the beginning, the treatment for any sprain, whether it's just a sprain, partial or full tear, is which I'm sure you have all heard, is the RICE therapy. So rest, ice, compression, and elevation. However, I take it a step further, and I implement the PRICE therapy. So the extra P is for protection. And I personally think that with ankle sprains, that it's important that it's protected at least for the first 5 to 7 days. What that does is it allows the body to, it accelerates the healing just a little bit more. By immobilizing the ankle, you can allow the ligaments to heal faster, get the inflammation down, and ultimately start to progress into that functional rehab stage. Because if you never get out of the acute phase, it's really hard to get back to full functioning. Although I know that players will still play with an ankle sprain, and I have done that myself, it's not the best for get you fully healed and safely healed. So I think that with a grade 2 and 3 sprain, personally, for me, I would immobilize. That's when I would choose to immobilize at least for 1 week. Grade 1, it's kind of up in the air, and I kind of judge based on what I see clinically. For plantar fasciitis, many times I don't immobilize plantar fasciitis. I go through a lot of treatments before I get to the point where I decide, okay, you need to be immobilized. And immobilization can be just placing you in a cam boot, but still walking, or immobilized can be just no weight on at all. And it takes me a long time to get to that point to immobilize a patient. So if someone has chronic plantar fasciitis, if they're telling me they have pain that's about 8, 9, or 10 out of 10, that's when I would usually decide to immobilize. But if an athlete told me that they had a tear, whether a partial tear or, I mean, they're not going to tell me, but if I see that they have a partial tear or a full thickness tear, I immobilize that immediately. It's very important for those athletes to be immobilized, and it could be up to 6 weeks that they're immobilized for that plantar fascia to actually heal. And then for shin splints, it's really important that they do go through a period of immobilization, especially if it's something that's chronic, and because it's a vicious cycle with shin splints or medial tibial stress syndrome. They get that inflammation, it heals, or they think it heals, and then they go back out in the field or they try to run again, and it just flares up, and it just keeps going and going and going. And sometimes there needs to be a break in the cycle where they're immobilized for a good period of time, where they can even tolerate walking. Once they can tolerate walking without pain, then I'd advance them to just a little bit of activity. And if they can tolerate that, then we can get them back to full playing at that point. And then with Achilles tendonitis, I don't have a hard and fast rule for immobilization, but I do feel if all the non-surgical treatments that I've implemented at a certain point don't work, then if I immobilize patients for a couple weeks, that usually is enough for their inflammation to calm down enough where they can get back out in the field, as long as they continue to stretch and do all the things that they need to do.
Gotcha. Sounds good. So to get into kind of the nitty gritty, I guess. So during a season of play, because it's fairly easy to treat some of these injuries when a student athlete isn't in season, but when a foot or ankle injury becomes chronic during a season of play, what strategies do you personally use to allow the student athlete to continue competing?
Sure. So my number one rule as a doctor is to make sure that you as a patient and an athlete are safe. So whatever decision that I come to, it's usually for your safety, because any injury that you experience can really change the course of your career and even your life. Some of these injuries can start off small but become very debilitating over time. With that being said, I'm also an athlete myself, and I know that not playing sometimes is not an option. So I do treat my athletic patients differently than I do my non-athletic patients, and not to say that I treat one group better than the other, but I understand the mentality is different. So there are different risks, and there's more acute goals, or I got to win this game on Saturday because then that means that we go to finals. If I get to play more this season, then I'll get more footage of me, more film time, and that could be beneficial for me to move on to another school and get a scholarship. I understand that there's all these different implications. I'm not sure if you guys heard the story this year from NFL player Tyrod Taylor. He was either first or second week, he suffered a broken rib. And normally for broken ribs, treatment is, there's not much of a treatment. It's just you're not playing, you're waiting for the bones to heal until you can tolerate playing. But he requested that he get an injection at halftime so that he could continue playing. An injection or a steroid of something to help numb the pain just so he can continue to play. And that for him meant he gets to keep playing. And the risks are higher. We usually don't do that, but the doctor decided to do it, and he ended up suffering from a pneumothorax because of that. So that's why I say it's, I understand some of the benefits, but there's also some risks, and we need to, that's why I would always consider those things. With all that being said, to answer your question, cryotherapy is a treatment that I'll usually implement. It's a whole body freezing essentially, and that helps with anti-inflammatory, as the whole body anti-inflammatory treatment, using immobilization devices like braces and splints and things like that. You can hurt something, put a brace on it, and it'll allow you to continue playing, because it gives you just enough to be able to continue. Giving patients high dose oral anti-inflammatories, injections of either corticosteroids or PRP, platelet-rich plasma, are some other things that I would usually do for chronic conditions, just to help athletes to continue to play. Implementing functional rehabilitation programs and extracorporeal shockwave therapy. Basically, it's just shockwaves that are used near the area of injury, and this can help heal, or it can help to reduce pain and promote healing of soft tissues or bone, or even bone. And then ionophoresis or phonophoresis, basically just getting some medication across to the nearby injured site via ultrasound or sound waves. So those are some things that I would some treatments to help patients to be able to continue to play if they have a chronic condition.
Gotcha, that makes sense. Yeah, and I'm sure that the toolbox is ever growing, and it probably varies situation by situation, right? Where Absolutely. In the season they're at, what their preference is, all of that stuff. Yeah, that makes a lot of sense.
Of course.
Well, thank you so much for your time. We appreciate you answering all of our questions. We actually had one more, but you kind of answered it already a little bit. Is there anything else that you wanted to add? Anything that you wanted the community at Chaffey to know?
No, just I think that sports is a very important part of your guys' lives. I think it's made a big difference in my life, and I think that you got to consider your health as well, and consider that some of these injuries can have huge implications on your life. So treat them seriously. Listen to the people around you, and seek advice on what's the best way to help you to be the most fit and most healthy, so that you can actually compete at a high level. If any of you guys have any questions, you could always email me directly. My email is Dr. Dr. Benjamin Kamel and at gmail.com. And then you could also find me on Instagram. I'll post some informational posts every once in a while, sometimes related to sports medicine, sometimes not, but all related to foot and ankle. And that's Dr. Benjamin Kamel, at Dr. Benjamin Kamel. And you can find me on Instagram.
Cool. Sounds good. Well, again, thank you very much for your time. Always informative, definitely. And we'll definitely be looking forward to working with you some more in the future, hopefully sending some of our student athletes your way.
Awesome.
Okay,
Thanks so
sounds
much.
good.
Thank you, Doctor.
Thanks, guys.
Have a good one.